Good evening, I'm Pinky Webb. Tonight we ask the questions, we tackle the issues, we clarify matters, and we get on point. The Philippine Health Insurance Corporation, or PhilHealth, gets zero state subsidy to fund its programs. Senator Grace Poe says the health insurer still has some 600 billion pesos in reserve funds, which should first be used to improve its services and address delayed reimbursements. But some lawmakers and concerned groups believe this is outright illegal. They also fear the budget cut and recent transfers of billions of pesos of PhilHealth funds to state coffers will greatly affect the agency's members. Let's get on point with former Commission on Population and Development Executive Director Dr. Juan Jeepy Perez. Dr. Jeepy, pleasure to have you. Thank you so much for your time.
Yes, nice to be here, Pinky. Good evening to all.
Good evening. It's really quite confusing to a lot of people.
Yeah.
First, there is a transfer, supposedly, of 89.9 billion pesos of PhilHealth. You can call it excess funds, reserve funds, or surplus to the National Treasury, to which only, if we recall, 60 billion was transferred so far because the 29.9 was stopped by the Supreme Court.
Yes.
And then you have Senator Grace Poe saying there is 600 billion pesos in reserve funds of PhilHealth. And yet, the normal feedback would be we're not getting enough, we're still paying a lot out of pocket, and our premiums are still quite high. Why is this happening? Can you make us understand or give us a sense of why this is so? Why are we not benefiting from so much money of PhilHealth?
Well, it comes from the expectation that PhilHealth, when it started in '95, was expected to cover up to 30 to 40% of the cost of healthcare in the country. And over the past almost 30 years, it has failed in that effort. It's now covering only 14% of healthcare in this country. So they're far off from the expectation. And what has happened is they rolled out packages in stages. And the last major package they rolled out was in 2014. And they did not update that until recently, when I think in February this year, they increased it by 30%. So over the last 10 years, the costs of healthcare have spiraled while they were using this old system of estimating health costs. So they have made no dent on out-of-pocket costs.
Ibig sabihin po nun, in 2014, 10 years ago, meron po silang formula kung magkano ang babayaran sa kung anong sakit. Tama ho ba?
Yes.
And then hindi po nila yan pinalitan up until 2024.
Yes.
Okay. And then what happened in 2024? You said it was increased by 30%.
Yes.
What do you mean by that?
30% from the cost in 2014.
Opo.
So even in 2014, they were not paying the whole cost, no? They were saying they will probably cover only 40% of the actual cost. So hindi pa nga nababayaran yung kung ano hindi pa nako-cover yung cost in 24. 10 years later, in-increase by 30%, yung inflation lang ang na-cover niya.
Na-cover nung increase na 30%.
Yes. So
okay.
People continue to complain that they spent hundreds of thousands, pero ang kinover lang ng PhilHealth 30,000 pesos or so, because they have not moved forward on that package.
And why not?
Well, it's something PhilHealth should answer. No? But when you talk to President Ledesma, and I've heard him in the Senate floor, he's saying that, no one did anything about it until he came in. So that's his defense.
And to be fair to him, when did he start sitting as head of PhilHealth?
I think he started late 23 or late 22, I think.
Okay.
Late 22. So it's been there maybe a year and a half.
Right, okay.
So he says he's done that, but it's still not quite enough. No? Plus, PhilHealth was supposed to cover outpatient costs. PhilHealth only covers hospital costs. Yet many people, the poor, the seniors, they go to clinics where PhilHealth does not pay for anything. They do not go to hospital because you go to the clinic first. So there is no package in PhilHealth for that except for a few diseases like TB, family planning, etc. So under the UHC law, they were given 2 years to come up with a package. There is
For
now
outpatient?
Yes.
In clinics?
In clinics,
Okay.
yes. And hospital and RHUs and private clinics. So now they have a package. It was initially 500 pesos per person last year. Then they increased it to 1,700 per person. They have enrolled around 22 million people into that program. They said basically all the local government RHUs are there, plus some private. But they only spent very little there are very little claims on that package.
Why?
Because nire-require nila what they call itong first patient encounter. You have to go to the clinic, get registered, get examined, and then susulat ang clinic sa PhilHealth, meron na kaming patient. So kailangan ma-enroll ka, ma-register ka.
That's why you were saying there
Ang
are
bagal,
only 22 million enrolled. So who are eligible to be enrolled? Anyone, or is it just...
Everyone. All Filipinos.
So, ibig sabihin, pwede po tayo pumunta sa barangay health center?
Rural health unit usually.
Okay.
Pero pwede rin sa barangay.
Magpatingin sa,
Sa-
the doctor there or the physician there?
Yeah. PhilHealth requires a doctor to see you. But some LGUs, I think, are allowing nurses or midwives to do the first patient encounter para lang makaklaim na sila. But it's a very slow process. And it's only happening actually approved for advanced implementation in 5 or 6 provinces and cities.
Hindi pa po nationwide.
Hindi pa.
Okay.
But they enrolled already so many. But
Yeah.
the package is not really coming out yet.
Right.
They're hesitant to really make it a national
Why?
program.
Because they'll end up paying for this.
Yeah,
It'll
the
be a lot.
total cost for that is 194 billion. If all Filipinos are
Yeah.
covered by that, it's 194 billion.
Where did you come up with that number, 194 billion?
It's total population, 112 million, times 1,700 pesos
I
per
see.
person.
Because that is the cost per person.
For laboratory, for consultation. Wala pang gamot doon, wala pang medicine.
Dr. G, is this the Consulta package
Yes.
that you're referring to? Iba pa po to dun sa sinasabi niyong enrollment for outpatient costs? Because I think we jumped to the Consulta package.
No, that is part of the Consulta package. To get onto the package, to get enrolled, you have to go through that first-person encounter. So, medyo maraming barriers to get there.
Aha. Parang pinahihirapan po tayo.
Let's say they're afraid of giving out so much money to local government units and not being sure about the performance.
Okay.
So that's part of the fear, but that's also leading to the problem now where you have many patients going directly to hospitals because there are no services available in the clinics.
Right.
So DOH is complaining, and I saw it's over 100% occupation in the DOH hospitals. So they're congested at DOH, while the primary level of care and maybe some local government hospitals are really not moving along.
Sayang.
Yeah,
That's a
because
waste.
PhilHealth has all of these resources.
Yeah.
But PhilHealth is a partner. It's not delivering the service.
Okay. All right.
The LGUs, DOH, and the private sector had to make claims to PhilHealth, so PhilHealth can pay out the money.
True. So the BICAM, the Bicameral Conference Committee, very recently had revealed that they were going to give PhilHealth a zero budget. Why? Senator Grace Poe says because there's 600 billion pesos in surplus. We're going to discuss that. Let's talk about that. After the break, we'll have more of our discussion with Dr. Jeepy Perez. Please stay tuned. This is On Point.
Good morning, I'm Mikey Oreta, and you're watching Basis Points, where we dive deep into the numbers and the stories that drive our economy and shape our world.
Stay ahead of the curve with the latest on financial dynamics.
The Philippines' trade deficit hits its highest level in over 2 years. The Philippine stock market continues to plummet. The Philippine Economic Zone Authority is on track.
Join us as we delve into the evolving economic landscape. Mikey Oreta, Basis Points, 9:30 a.m. Only on BNC, the Billionario News Channel.
Hello and welcome to Follow the Money. I'm Rain Musni. Join us as we explore the tools and insights you need to jumpstart your financial journey. The crypto market climbed over $800 billion. Tech giant Alibaba has announced plans to issue notes. Investors are anticipating a significant downward move for the cryptocurrency. Swift is adding a new chapter to her record-breaking year.
Follow the Money, 10:30 a.m.
Keep it here on BNC, the Billionaire News Channel. Always on top.
Welcome back. You're watching On Point, still with us, Dr. Jeepy Perez. So zero budget for PhilHealth. What's your reaction to that, and what is the net effect of that to us, to the public next year?
Well, for one, you have to look at the trend of payments being made by PhilHealth. At the time that Senator, then Finance Secretary Recto, made the analysis that there were excess funds in PhilHealth, PhilHealth was not paying so much in terms of reimbursements. However, this year, PhilHealth will be paying out around 200 billion pesos. And it will keep going up because they keep adding benefits. So if you were, let's say, a corporate manager looking at the financial resources, you have to look at the money that you have will have to cover liabilities that you have not paid for. And then you added benefits that you will have to pay for this year and next year. And you have to make a diligent analysis that I may not have enough money. And actually, COA has a report out that just came out this December saying that the liabilities of PhilHealth are over 1 trillion. And with a budget, they only counted 480 billion. They said, it's a negative members' equity. It's a negative because of all the future and other unpaid claims, etc. But that's only come out right now. So the Senate was not able to appreciate that. Probably Congress did not have the benefit of looking into that COA report.
Let me cut you there. If the COA is saying that PhilHealth has a liability of 1 trillion, does that mean automatically that they have to pay 1 trillion pesos?
No.
Okay.
Because, PhilHealth is the sole payer of health insurance in this country. All 112 million Filipinos. You have to look at the possible consequences of that over their whole lifetime. So when they make out these liabilities, they look at the entire population. So it seems huge, no? But, for example, if COVID had a big effect, they have to cover for that. If there's another rise of pneumonia or other diseases, if non-communicable diseases are rising, they have to cover for that. Those are liabilities that they...
So it's a forecast.
It's
Would
a
that
forecast.
be correct, that
Yeah.
1 trillion in liability is a forecast?
They may not spend that.
Right.
But it's
Ito yung
something they have to...
you may need this money because you may have to pay this much.
Yes.
Is that next year?
That could
That
be
1 trillion?
Some of that would be actually spent this year because of all the new packages they've rolled out.
Okay.
Instead of 200 billion payout this year, it may be more than that. So their forecast may not be enough for this year. So if they get no money next year for indigents, for example, the ones who are paying, the workers, the civil servants, the private sector, they will be carrying the brunt of the premium subsidies of all the poor that government is not paying.
Okay. What is, maybe a simple explanation, what is the effect of a no budget for PhilHealth next year? Number one, will that affect the benefits? Will that affect their ability to pay hospitals?
I think it should not affect, in the near term, The cost will probably go up to 250 billion next year. So if they have an income of 200 billion or more from the private sector, that will cover the cost for next year. But,
Well, not really.
And
You
then
have a 50
they will have
billion.
to go into some of the reserve fund that they have. By law, they're required to have 2 years reserve fund, which is around 400 billion. So
Is 400 billion 2 years or every year?
that's for 2 years.
Okay, so it's 200 billion
a
per year. Okay.
Yeah. So they will eat into that. And
But that we shouldn't be concerned. We shouldn't be very concerned about that because they have 600 billion.
yes, but if they roll out the Consulta package, that will be 194 billion. If they start paying out 1 million pesos for dialysis per dialysis patient, and there are, I think, over 5,000 patients, that's 5 or so billion a year that they will add on. So it keeps adding up. New packages that they bring on will add up. The most important package, though, is the Consulta package. And that is supposed to, hopefully, down the line, bring down the cost of hospitalization. That's why it's so urgent for them to come out with that now. But
fact-
that will cost 194 billion.
Yeah, you were saying. And to those who do not know or who are not aware, one of them, I only found out about that during my interview with Dr. Minguita Padilla, na meron palang Consulta package. But you made it clear that you can't just go to any hospital and avail of this Consulta package. Basically, you said what you had told us earlier, that kailangan mong mag-apply online and then somebody has to see you in the
a first-person encounter, they call it.
first-person encounter. It cannot be your doctor in your private hospital.
Wherever you registered.
Aha.
You register in a clinic, let's say the rural health unit in Quezon, the health center in Quezon City. Then you go there, get and they make the claim to PhilHealth. Hopefully, they will provide you the service without waiting for PhilHealth to pay.
I wonder if that will happen. I wonder what really happens on the ground.
It depends on the financial
Okay.
capacity of the local government unit, for
but
example.
Dr. G, so we're clear about that. Pwede po sila pumunta sa kanilang mga health clinics, sa
Yeah.
mga LGU, sabihin nila they want to avail of this Consulta package, and then it works from there.
Yeah. A specific example. I talked to some senior citizens in Bagong Silangan, Quezon City, one of the poorer barangays there. They told me, and I told them about e-Consulta. They said, oh, we want that. But they were told by the city health office that only one center will start doing that. So one center can cover only probably 20,000 patients, or so with 2 doctors. So parang even the local government, even if they know there is that, they're hesitating to roll it out without the go signal from PhilHealth to really roll it out.
So it will fall under PhilHealth again. Siguro, Dr. GP, to inform us about this, tell us the steps on how to go about this and what is included in this Consulta package, because you're saying this is preventive. Meaning, if we are able to have the basic annual checkup for free, which is the Consulta package, hindi ho ba?
Well, they don't want to call it that, but it's a consultation and laboratory examination up to 1,700 per person.
Apo. At 1,700 pesos is something that we can all avail of. Yun nga po. Pagka tayong lahat mag-avail dito, this will cost PhilHealth 194 billion pesos.
If they roll it out nationwide.
If they roll it out nationwide. All right. So, is there something illegal about the decision of the BICAM to give PhilHealth a zero budget, knowing that there is a law that actually states that a certain percentage of sin taxes should actually go to PhilHealth?
Well, as a constitutional, looking at the Constitution, there is in the Constitution a right to health. Now, we have to understand, PhilHealth is the only payer for health services in this country. We are a single payer country. So if Congress says, we will not pay for the subsidy for 25 million members and 16 million dependents. That is the total number of people who are deprived.
Say that again, Dr. JB.
25 million members and 16 million dependents. That's 41 million Filipinos whose subsidies are no longer covered because Congress is not paying. So that is already one step towards depriving Filipinos of the right to health. Because other countries have other health insurance companies. But here we have PhilHealth as the only one. And it's the only place where they can go to for what we call financial coverage in health. Now it's gone. So we believe it is an affront on the right to health of Filipinos.
If the defense would be, to clarify, these 25 members, are these the indirect ones that you're referring
Yes.
to, plus the 16 dependents, yung kanilang mga anak, ano? Okay.
These are all the 4-piece members, around 10 million of them, around 11 million, 10 million senior citizens, PWDs around 2 to 3 million.
Okay. So if that is the case, could the defense be they will still be covered and the proceeds from the sin taxes don't have to go to PhilHealth because there is a surplus of 600 billion pesos? What do you say to that?
Well, if I were, let's say, a contributor to PhilHealth, I would say there's something unfair here. Because the ones who will be paying for the cost starting next year of the administration lang of PhilHealth will come from the private members.
What do you mean by administration of PhilHealth?
7% of the total income goes to pay for the salaries in PhilHealth.
So you mean we will be paying for that?
Yeah,
The
government
employees?
will not be paying because there's zero. The government share is gone to pay for that.
But I need to cut you there. They're going to say that you can take it from the 600 billion peso surplus, sir.
Yeah, probably. But that will, let's say, run out in 1 or 2 years. If they really cover all the health costs of Filipinos, they don't have enough money to run PhilHealth, to pay for all these packages that they're rolling out. So I think Congress needs more foresight in this. Think strategically and not think that you want to punish management. And to punish management, you will not pay for the premiums of all the poor. I think
But
that's
not their narrative. You
Yeah.
see, that's how you'd explain it to me, but that's not their narrative. They're
Yeah.
saying that the indigents, the PWDs, the senior citizens, they will still have their contributions because there is a surplus. Because I'm just...
No, it's a
I'm
reserve
guessing.
fund.
Yes, it's a reserve fund. There's 600 billion pesos. In fact, Senator Cheese, let me correct myself, Senate President Cheese Escudero said, simple lang ang paliwanag dito, not verbatim, Dr. JB. Sabi niya, ang kailangan lang para sa indirect contributions ay 50 billion. And ang kailangan for the packages or benefits would be 20 billion. So that totals 70 billion. Meron silang 600 billion pesos. Gamitin mo na yon. Yun po ang kanilang dahilan and explanation. So when you listen to that, it does make sense in some way or form.
Yeah, well, but actually, the 50 billion that he's talking about as the premium for the indigents is only 1/3 of the premium. The premium should be around 150 million.
So 50 billion is not accurate.
Not enough. It's not what PhilHealth asked for in the beginning. They asked for 150 billion. The other item, the 21
Packages,
billion, is actually PAGCOR and I think other sources that are regularly paid to PhilHealth to strengthen the packages. But of course, they have 500 billion. That is where they should be getting all the new monies, new benefits from. But just think about it. The Senate is pressuring PhilHealth to perform. So if PhilHealth performs, they will spend probably 300, 400 billion in a year if they roll out these packages. Yet they're not giving PhilHealth money this year, next year. So I mean, they will use up all the money to expand benefits, which is happening now, and people are really making bigger claims, but PhilHealth will not have enough. Year to year, they will not have enough.
So you don't think that 600 billion pesos really is a surplus for them to be able to maintain financial viability?
Yes, I think Congress and the Senate and the House should really look deeper into that, and not just say, look at the 500 billion. This is such a big amount.
Gamitin nyo to.
But you need 600 billion a year for health services.
There you go.
And
so that means
PhilHealth is
ubos
not
na yun.
using it. Yeah, ubos yun in 1 year.
We'll be taking another break. Stay tuned. This is On Point.
At BNC, 12 noon doesn't mean break. But
Good afternoon, I'm Mai Rodriguez. Today on Newsfeed at noon, staunch Duterte ally Salvador Panelo believes Vice President Sara Duterte will be impeached. United Nations hailing the ceasefire between Israel and Lebanon's Hezbollah. Australia officially banning children under 16 from social media. And those are the news this hour. Keep it here on BNC, the Billionario News Channel.
This is The Scorecard
where you score the latest sports news.
and in-depth views. I'm Anton Rojas.
I'm Erica Christensen.
get ready, be prepared, get to the latest stories, updates, and reports about what's happening in the world of sports. Hosted by Anton Rojas, Erica Christensen.
Where sports is our business and business is our sport.
The Scorecard, 9:30 p.m. on BNC, the Billionario News Channel.
Welcome back. I'm Pinky Webb. You're still watching On Point. Still with us, Dr. Jeepy Perez. So we were also talking about this assistance for indigents. So aside from, paano ho ba yun, Dr. Jeepy? The free medical assistance due to via PhilHealth to the indigents, tama ho ba?
Yeah.
They still have some help on top of that.
Yeah, what's happening is, I mean, starting this year, yung PhilHealth budget got cut to 40 billion. Hindi lang, and it should have been 80 billion. Yung 40 billion, roughly most of it, they put into MAIP, Medical Assistance for Indigent Program, run by DOH. And our fear there is more money is now going to go to MAIP than to PhilHealth. So it's the preferred option that you go through politicians, bureaucrats to get a guarantee letter, and then that will pay for your bills. Rather than
how
go
much is the
to
MAIP?
it was this year it's 58 billion.
Okay.
What we saw for next year, it will go up to 74 billion. So actually, the money that should have gone to PhilHealth is now in MAIP.
Why would maybe the lawmakers, actually, I have to rephrase that question because I think I know the answer there. But basically, what happens here is, pupunta po kayo sa mga lawmakers at hihingi kayo ng guarantee letter bilang tulong sa sakit. Yun eh. That's,
if you're in hospital and hindi ka makalabas because may utang, you go to Congress, knock on doors. And you know what the Heart Center people told me? They have wards full of people waiting for GL. They cannot discharge.
GL is guarantee letter.
It's affecting the affecting the health system.
But that's actually what I wanted to ask you, but I took it back. But I might as well say it. I was going to say, why would the lawmakers rather have this than give it to PhilHealth? And I just answered.
In an election year, it's important.
But that's the thing. That's patronage politics.
Yes.
At the end of the day, you ask for a guarantee letter from the lawmakers to be able to get some money to be able to pay for their bill in the hospital para makalabas po yung inyong mahal sa buhay sa ospital. But that's not their money, Doc.
Yeah.
That's our money. Hindi ho ba?
Ang tawag namin doon, pagmamakaawa na pondo.
Yeah.
While yung PhilHealth is, karapatan mo yun eh. Nasa batas, nasa constitution. That is how it should be. But now they're making us go through this pagmamakaawa.
And should not be the case.
You lose dignity, you have to
Hindi
bend
lang po
the knee.
Andun na po yung inyong mahal sa buhay sa ospital, hindi makalabas. Lipat pa kayo ng lipat ng mga opisina para kumuha ng GL, ng guarantee letter. That's why I was going to say, why not just put it in PhilHealth?
And get better management.
And get better management. Last question. If the president, well, number one, is there an appeal to the president? Do you guys have an appeal to the president regarding this?
Yeah, we have a statement that's gone out, basically asking the president to take action on this. And we will have a press con next week, probably before the president signs. We'll probably ask him to, because it's like a poison pill, this PhilHealth zero budget. It affects 41 million Filipinos who have no subsidy, no premium payment. So the president probably could return the bill to the Senate to correct that, and then he can sign it as soon as the Senate and Congress makes that correction. That will be our appeal. If the president goes on to sign it, that will be another.
And if he does, do you plan to question this before the Supreme Court? Again, because there is a law, the UHC law, and the sin taxes, where the sin taxes, a portion rather, a percentage of the sin taxes should be going to PhilHealth.
Yeah, we will probably have to go to the Supreme Court for that. And I think some lawmakers will join us there again.
Such as?
I think Coco Pimentel, Senator Coco already said.
Yeah, he was questioning that already.
Yeah, he did not vote for the budget.
And Senator JV, do you think he'll join you too? He is the author
Probably
of the UHC.
not, because he voted for this budget. I think Senator Risa, yes, hopefully JV thinks about it.
Right.
Senator Risa also voted no, so she might join us.
Thank you so much for your time, Dr. Perez. Good to see you, and you have a good weekend. Thank you.
Thank you, Pinky. Good evening.
And that's On Point. Join us again next week at 7:30 p.m. here on BNC, the Billionario News Channel. I'm Pinky Webb. Thank you for watching.